Hey everybody, I just wanted to do a quick tutorial on the laser because I've seen that people have been doing a couple of different things and I wanted to make sure we were all on the same page. For the ink, you only need to put a tiny bit right on the actual wart. Carrie doesn't have one, we're just pretending. You don't need to put a whole bunch of it in one area because otherwise if you do that you won't be able to see the wart itself, and you want to be able to actually see the wart. Make sure that the tongs are actually touching the person's foot and you can line it up to where the ink is and just push quickly. That's it. And it shouldn't actually really hurt. With the cryo machine, I literally put it on for about 10 to 15 seconds. Then I take it away and then I do the wart so that we don't get any frostbite. If you do the wart and it's a large wart, you can literally just tap it and that's as quick as you should be going. Any of this tap stuff will probably work, but it won't be as effective as if you do it a little slower because it won't be as painful and you won't wreck this $30,000 laser that we have. If this is a huge, let's say, mosaic wart, and you've fired up some areas where you see some really dark root, then you can hold it and just go back and forth like this to the area for about 5-10 minutes, and it'll dry the area out and it'll cauterize it. So you'll be able to hear. And you're just going over it like a low level. So the bigger warts, you can do it that way. We get really good reactions from that. And then if you have the smaller warts, you just put it in like that. And don't slather it with a whole bunch of ink because you're just not going to be able to see it. When you're tapping the actual foot paddle, just 1, 2, right, like this, right? So then this way, it's super quick and it won't hurt the patient. If you do it multiple times, you may hit the same area and you're going to cause more damage to the skin.